Hi, my name is Devin, a student nurse practitioner with the University of Memphis. Today is August 12th, 2023, and I'm going to be doing your assessment. I'm going to start by noting that your head is central and is midline with your body. It's normocephalic and symmetrical. There's no obvious deformities. I'm going to go in and palpate your head. I don't palpate any lesions or masses. I don't see any infestations. There are no depressions noted. There are no infestations. Your hair is dark in color, coarse in consistency, and evenly distributed. Did you have any tenderness when I touched your head? Okay. Now I'm going to palpate your temporal arteries. Did you have any tenderness when I did that? Okay. Now I'm going to palpate your masseter. I'm going to palpate your jaw for TMJ, so I'm going to get you to open, close. No crepitus or subluxation. Did you have any tenderness? No. All right. Now I'm going to check cranial nerve number 5. So I'm going to have you clench, okay, and that was equal bilaterally. And then I'm going to have you close your eyes and tell me where I'm touching.
Forehead, right cheek, left cheek, chin, nose.
All right, and so that was your light touch sensation intact with cranial nerve number 5. So now I'm going to go on and palpate your lymph nodes. I'm going to start with preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. And did you have any tenderness? Okay. And all of those were soft and mobile. So now I'm going to move on to your ears. I notice that they are normal size for your head. They are symmetrical and they are at an even height. They're both the same height. Right? And I don't notice any lacerations, lesions, or abnormalities. And no obvious deformities. I'm going to palpate your pinna and tragus. Did you have any tenderness? No. Right? And there were no masses noted on that palpation. Now I'm going to look in your right ear. And your ear canal is free from debris. Your tympanic membrane is intact. And there's no discharge or lesions in that ear. Now this ear. Again, no discharge or lesions in the ear canal. That tympanic membrane is intact. And now I'm going to move on to 3 hearing tests. All right, I'm going to start with the whisper test. And this hearing is cranial nerve number 8. And I'm going to say 3 words, and I want you to repeat them, okay?
Okay.
Pants.
Pants.
Shirt.
Shirt.
Socks.
Socks.
All right, and then again, I'm going to get you to cover your right ear. And again,
Car.
garage,
Garage.
house.
House.
Okay, and cover your left ear. Dog,
Dog.
fish,
Fish.
bird.
Bird.
Okay, and so gross hearing is intact. Now I'm going to check the Weber test for lateralization. You're going to tell me if this is louder on the left or the right side.
It's the same.
Okay, I'm going to have you sit up a little bit. I'm going to check your Renee test and tell me when the sound stops.
Stop. Stop.
Okay,
Stop. Stop.
all right. And that showed that your air conduction is greater than bone. Air conduction is greater than bone conduction, so no conductive hearing loss. All right. Now I'm going to move on to your eyes. I can see that your eyelashes and eyebrows are evenly distributed. There's no signs of infestations, and they're evenly distributed. No signs of infestations. Your palpable fissures are even and appropriate for your age. I'm going to get you to look up. Your conjunctiva in sclera, your conjunctiva is pink, your sclera is white. There are no lesions or discharge noted there. So now I'm going to move on to cranial nerve number 2. And I'm going to check your visual acuity and central vision, and then we'll do peripheral, okay? So I'm going to get you to hold that, cover your right eye, read that line.
OLCF.
Cover the left eye, and read that line.
OLCF.
And both your eyes, and read that line.
OLCF.
All right, so your central vision is intact, and your visual acuity is 20/20. Now I'm going to check your peripheral vision. I'm going to get you to lean up a little bit, look at my finger.
I can see it.
All right, right here.
I can see it.
Perfect. So your cranial nerve number 2 is intact. Now I'm going to move on to testing your red reflex. And your red reflex is equal bilaterally, and your optic disc is round and well defined. And now we're going to check cranial nerve number 3, which is light accommodation, both consensual and direct. And you do have both consensual and direct light accommodation from 5 millimeters to 2 millimeters. And now I'm going to check cranial nerves 3, 4, and 6 with your extraocular movement and conjugate gaze. And there's no extraocular movement noted there, so cranial nerves 3, 4, and 6 are intact. Now I'm going to just check for accommodation and convergence. I'm going to get you to look at my finger and follow it in. And your eyes did accommodate and converge, so accommodation and convergence are intact. Check your red reflex, check your accommodation at light, EOM. Okay. Now, I'm going to move on to your sinus system. So I do notice that your nose is straight and midline. I'm going to get you to cover one nose and breathe out. And the other side. All right, and so your nose is patent bilaterally. I'm going to palpate your frontal, maxillary sinuses. There's no warmth. Did you have any tenderness? Okay. All right, I'm going to get you to smell this. All right, what does that smell like? Okay, so cranial nerve 1, sense of smell is intact. Now let's move on to your cranial nerve number 7. So I'm going to get you to smile for me, frown, and then puff your cheeks, pucker your lips, and raise your eyebrows. All right, cranial nerve number 7 is intact. Okay, now that completes our assessment of those things. So now I'm going to move on to your mouth. So I'm going to get you to open up. And I see that your tongue, your lips, gums, buccal mucosa, palate, posterior pharynx, the floor of your mouth, and your salivary glands are all pink, moist, and intact. Your teeth are white and well aligned with no obvious caries. And now I'm going to get you to open your mouth again and say "ah." And that's cranial nerves number 9 and 10 with your soft palate rising with pronation. I'm going to get you to stick your tongue out. And there's no fasciculations noted on your tongue. And that is cranial nerve number 12 intact, okay? So let's see here. Okay, now I'm going to palpate your trachea, and it is midline. Did you have any tenderness?
No.
All right. Now I'm going to palpate your thyroid, so I'm going to get you to swallow and swallow. All right, and did you have any tenderness?
No.
And that thyroid was soft and mobile with no nodules noted and equal symmetrically. All right. Now I'm going to palpate your carotid, and that is a +2 pulsation bilaterally. Now I'm going to auscultate your carotid. And there was no bruise noted on auscultation, okay? So that moves us along to your chest assessment. So I'm going to just note your skin, and throughout the assessment, I'm going to be checking the skin of your face, neck, posterior, anterior chest, head, and abdomen, and I'm checking for color, temperature, moisture, lesions, edema, bruising, scarring, nevi, and anything else. Hold on, it was color, temperature, texture, moisture, bruising, nevi, lesions, scarring, and moisture of your skin. And I'm just going to be checking that throughout the assessment. And I don't notice any abnormalities. In addition to that, I'm also noting that your chest, both anterior and posterior, has no obvious deformities and it is symmetrical. And I'm going to move on to auscultating your lungs. So I'm going to get you to turn right so we can see your full back. Okay? And you can just take a deep breath when you feel my stethoscope, okay? All right, and there's no adventitious lung sounds noted on that assessment. Now I'm going to move on to bronchophony. So I'm going to get you to say 99 when you feel my stethoscope.
99, 99, 99, 99, 99, 99, 99.
All right, and there was no consolidation noted there. Now I'm going to move on to egophony. I'm going to get you to say E, okay?
E, 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 E.
All right, there was no consolidation noted on there. Now we're going to move on to lastly, whisper peptowilliquy. I'm going to get you to say 1, 2, 3.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
All right, and there was no consolidation noted there. Now, while I'm looking at your back, I'm going to go on and palpate for symmetrical chest expansion. Take a deep breath and let it out. and you didn't have symmetrical chest expansion. And now I'm going to palpate tactile formitis, so say 99. 99. Okay, and that vibration was equal bilaterally. While I'm on your back, I'm going to go in and check for costovertebral tenderness. Did you feel any tenderness?
No.
All right. Did you feel any tenderness?
No.
Okay. Now lastly, we're going to percuss these in intercostal spaces. And that is a reticent sound. All right, which is a normal finding, so you can go ahead and turn around for me. Now, in addition to his respiratory anterior and posterior, I'm also assessing for retraction, cyanosis, tachypnea, nasal flaring, tripod positioning, and any use of accessory muscles, which I do not note. Okay? And then now I'm going to move on to his respiratory status on the front. And you can take a deep breath every time you feel my stethoscope. Okay, and there was no adventitious lung sounds noted posterior or anteriorly for this patient. And I'm going to go in and palpate for chest expansion, deep breath. He does have symmetrical chest expansion, and then tactile formitis, say 99.
99.
And that was an equal vibration. Now we're going to move on to his cardiac assessment. I'm going to start by listening to his heart for 1 full minute. And that's a regular rate rhythm with no, at 88, with no murmurs, rubs, or gallops. I'm going to palpate the point of maximum impact with no thrills noted. Now I'm going to auscultate his heart sounds with the diaphragm and then the bill, starting with aortic, pulmonic, Erb's point, mitral, tricuspid, and then in reverse, tricuspid, mitral, Erb's point, pulmonic, aortic. And there was no murmurs, rubs, or gallops noted on this cardiac assessment. Okay, now I'm going to have this patient lay down. All right, and the first thing I'm going to note is, are there any heaves or lifts? And there are not any heaves or lifts. I'm going to have him turn his head to the left. And there's no jugular vein distension noted. I can see a slight jugular pulsation at 2.5 millimeters here, and so that is a normal finding for this patient. Now I'm going to go on and palpate my cardiac points, which is aortic, pulmonic, Erb's point, mitral, tricuspid. There was no thrill noted, and then I'm going to repeat my cardiac assessment. Aortic, pulmonic, Erb's point, mitral, tricuspid. And again, no murmurs, rubs, or gallops noted with that cardiac assessment. All right, now I'm noting the abdomen. It is symmetrical. There are no masses. There are no obvious deformities noted. And so I'm going to start out with auscultating. I'm going to listen to his bowel sounds. Bowel sounds are normal, active in all quadrants. Now I'm going to auscultate his aortic, his abdominal arteries. I'm going to start with aortic, and then renal, and then iliac, and then femoral. And there was no bruise noted on that auscultation, okay? Now we're going to percuss his abdomen. And there's no dullness or flatness noted, and it is a tympanic sound. All right, now we're going to palpate his abdomen, starting from light to deep palpation. Did he have any tenderness? Okay. And I did not palpate any masses in his abdomen. And again, it is symmetrical bilaterally. Now I'm going to palpate his liver on the right sternal border, and it's non-palpable. Now I'm going to move over to his spleen, and I'm going to have to place my hand on his back, take a deep breath, and his spleen is non-palpable as well, okay? So now I'm just going to review my assessment really quickly. And I'm going to go on and have this patient sit up. Okay? Now, with this patient sitting up, I'm going to note that his upper and lower extremities, there's no edema. The skin color is within normal limits for his race. It is warm, dry, and intact. All of his extremities and digits are intact and present. And now I'm going to have him close his eyes, and I'm going to check for light touch. So tell me where I'm touching.
Right arm, left arm, left leg, right leg, left leg, right leg.
All right, so his soft touch is intact. And now I'm going to move on to graphesthesia and stereognosis. So I'm going to get you to give me your right hand and tell me what I'm writing.
B.
Okay?
O.
Okay. graphesthesia intact. Now we're gonna check for sterignosis. So tell me what's in your hand.
Right.
Okay, and then your left hand. Tell me what's in your hand.
Icon.
All right, sterignosis is intact for this patient. Now I'm going to check his vibratory sense over his wrist and medial malleus, malleosus. Can you fill out?
Yes.
And that. All right, the other side.
Yes. Yes.
Okay, so that is intact as well. All right. So while we're checking reflexes and things, I'm going to go and check his deep tendon reflexes. So I'm going to start with his brachioradialis, bicep, and tricep. And that is all +2 in brisk on the right side, and then the same thing on this left side. Brachioradialis +2 in brisk, bicep +2 in brisk, and tricep is +2 in brisk. All right, now I'm going to move on to his knees. And I'm going to check the right knee, +2 in brisk, left knee, +2 in brisk. Now his Achilles, +2 in brisk, +2 in brisk. While I'm here, I'm going to go on and check for Babinski. And he has a negative Babinski because his toes do not fan out. All right, now I'm going to check for cerebellar coordination with serial finger opposition, hand flip-flops, and then touch my finger. Okay? And his cerebellar coordination is intact. All right, now I'm going to check the, start low on his feet. I'm going to check the capillary refill in his toes. It's less than 3 seconds. His dorsalis pedis is +2 bilaterally. His posterior tibialis is +2 bilaterally. And then his fingers, capillary refill is less than 3 seconds. And then his radial pulses are +2 and equal bilaterally, okay? So now I'm going to move on and check his joints. So I'm going to start with his toes, and I'm assessing for crepitus, swelling, redness, edema, obvious deformity, nodules, or any asymmetry, starting with toes, ankles, knees, hips, hands, wrists, elbows, shoulders. And again, there was no abnormalities there, no obvious deformity, swelling, redness, nodules, crepitus, or anything like that noted. Okay. Now, I'm going to assess strength. So I'm going to get you to, I'm going to start down here with your feet. I'm going to get you to push against me with your feet and then pull against me with just your feet. Just your feet. There, pick up your, there we go. All right, so that's +5 bilaterally. All right, now your knees, so push against me, pull against me. That's +5 bilaterally. Push against me, pull against me. That's +5 bilaterally. Or 5 out of 5 strength bilaterally. And the feet, the ankles, knees, and hips. Now your hands, squeeze both of my fingers. All right, that's 5 out of 5 bilaterally. Arms out like this. Push, pull. Biceps and triceps are 5 out of 5 bilaterally. Now shoulders, push up against my arms, and then pull down against my arms. Okay, that's 5 out of 5 strength. And the last strength I'm going to check is his shoulders, and that's going to be cranial nerve 11. So I'm going to get you to shrug against me. All right, and that is equal bilaterally, so cranial nerve number 11 is intact. Alrighty, so now we're going to move on to range of motion. So I'm going to get you to flex your fingers, flex, extend, hyperextend, abduction, adduction, thumb opposition. And then with your wrists, we're going to flex, extend, hyperextend, and then this is radial deviation, so ulnar deviation, and then rotation. All right, and now your shoulders, we're going to do this. This is going to tell us extension, hyperextension, and then internal and external rotation. Okay, and then abduct your shoulders, adduct your shoulders, and then rotate your shoulders. Okay, good. So we have full range of motion in our upper extremities. So now we're gonna move to our toes. We're gonna flex, extend, hyperextend your toes, and abduct and adduct. So you have full range of motion in your toes. Now with your ankles, you're gonna plantar flex, dorsiflex, eversion, inversion, eversion, okay, and then rotate. So you have full range of motion in your ankles. Okay, now I'm going to go on and have you stand up for me. And we're going to move on to your knees. So I'm going to get you to flex, extend, hyperextend, both knees. Okay, that is full range of motion. Now we're going to move on to your hips. So we have internal rotation, external rotation. Then we have circumduction, and then abduction, adduction, and then extension, flexion, hyperextension. All right. Now the other side, same thing. Eversion, inversion, circumduction, abduction, adduction, extend, flex, hyperextend. Okay, full range of motion in your hips. Now we're going to move on to your cervical spine. So we're going to flex, extend, hyperextend, and then lateral flexion. All right, full range of motion in your neck. Now we're going to move on to your lumbar spine. We're going to flex, extend, hyperextend, and then we're going to move on. You're going to laterally flex, and we're going to rotate your lumbar spine. All right. And we're going to circle back to your cervical spine really quick and just have you do a rotation with that. So that's full range of motion in both our cervical and lumbar spine. All right. Now I'm going to have the patient turn around and bend over. And I'm going to have the patient slowly raise up, noting the normal curvature of their spine. It is a straight spine. Did you have any tenderness?
No.
Okay. So normal curvature with no scoliosis noted, no tenderness, no crepitus, and it's no obvious deformities in that spine. So I'm gonna have the patient walk over to the wall and then walk towards the camera. All right, and then walk back to that spot, heel to toe. All right, and that patient does have a steady gait. Now I'm gonna have this patient hop on one foot with their right foot, and then the other. All right, and this patient does have a strong gait. Now I'm gonna have them put their legs together, close their eyes, and raise their arms out, and have them stand in this position, testing Romberg's test, and it is negative. So that means you can relax now. You don't have any abnormals with your Romberg test. All right, now I'm gonna have you have a seat, and I'm gonna kind of review my assessment and just check if I missed anything really quick. Pulses. I think that's it. Thank you.